In this penultimate webinar in the series, we're going to turn to finding solutions, and I will be questioning our panel about current and future pathways to better detection, diagnosis, and treatment of rare diseases.
But the problem is then you have multiple codes. Certainly in the United States, you know, CPT codes for diagnosis and for different things, and then you can ultimately have many diagnoses, but not the correct one, because really the vast majority of rare diseases do not have a CPT diagnostic code right now. And then again, in the United States, that makes it tremendously difficult with respect to, you know, putting the appropriate treatment in place. So, you know, through this International Rare Disease Research Consortium I've talked about, you know, we've been trying to, you know, we pulled some workshops together really, and the idea is that we need to be better at mining the electronic medical record, or mining the information, and then, you know, probably using artificial intelligence and some sort of sophistication in terms of, okay, these are the different symptoms that are associated to a disease. Because when it comes down to it, despite the fact we want a genetic diagnosis, most rare diseases still only have a clinical diagnosis based on the symptomatic presentation of the disease.
Marta, how do we need to think about this? What needs to change in the training of physicians so that they are more aware of rare diseases and maybe don't just dismiss or misdiagnose, which is clearly another issue?
We need to start to build up teaching and courses even at the university level on rare diseases. For example, I teach at university, and there is no specific teaching for doctors, so for medical students. I think that this is an important first step, because they need to understand since the beginning of their careers that there are rare diseases. And probably, I mean, I teach about some rheumatic rare diseases. Probably it should be a dedicated course on rare diseases, on how we deal with this, on the issues we have with patients with rare diseases, sometimes even in spite of the diagnosis or the type of disease. And but then we need to move on. For example, within the ERNs, we have educational projects for GPs, healthcare professionals, is nurses, is physiotherapists, because I suspect diagnosis might come from any healthcare professional, not only physicians. And this is very important, you know, because we might go to a physiotherapist or nutrition specialist for some symptoms we have, and these symptoms might be related with a rare disease.
The amount of information that companies like Healx, you know, could use to try and predict a treatment, come up with a better understanding of the patient phenotype, the disease biology, etc., is really immensely valuable, and particularly around more of a patient journey, so that it's not a snapshot, but something that keeps evolving, because most rare diseases are progressive, and so you want something longitudinal. So you want information that kind of goes with the patient. But then how do we make it as easy as possible for the patients and families to contribute to that, to share their data, to empower them to do so, and also potentially come up with a solution that is useful beyond the natural history and research that all of us are trying to do.
And there are many other societies, for example, ICORD, which is an international conference society for rare diseases, and other initiatives, but there is not a unique hub where we can collect, for example, all this information. So maybe we need a unique hub at international level, not just European or not just Australian or USA, but globally, because now, I mean, we know very well rare diseases have not barriers.